If you have an active toddler or a kid who is into sports, it is best that you should know what to do when your kid gets a concussion. What is a concussion? It is a traumatic brain injury that disrupts normal brain function. It can be brought about by a bump, a blow, or a jolt in the head. Or it can also be caused by a hard hit to the body wherein the head and the brain move back and forth inside the skull. This back and forth movement would and can lead to chemical changes that might damage brain cells. In this video, we are going to talk about concussion. What are the causes? What are the symptoms? And what symptoms, when should you worry and call the doctor or bring your child to the ER? We'll also talk about how to diagnose and treat concussion. And are imaging tests needed all the time? We will also talk about the road to recovery if your child is recovering from concussion. And lastly, we will talk about ways to prevent it. Hey, I'm Dr. Kristine Alba Kiat. I'm a board-certified pediatrician, and my mission is to help moms and dads deal with child health problems to raise happy and healthy kids. Concussion. What are the causes of concussion? Well, any activity that can lead to injury to the head can lead to a concussion. This is especially true for contact sports such as football, soccer, wrestling, and basketball. It can also be found in other activities such as biking, skateboarding, and also tree climbing. It is also commonly seen in motor vehicular accidents and falls. Kids tend to get concussion more often seen in children who are younger than 4 years old and when kids are in their teens. This is because they tend to take more risks because of peer pressure or their urge for independence. After a head injury, your child might experience some of the symptoms of a concussion. Your child might appear stunned or dazed, and when the injury happened during sports, your child might forget or might be unsure of his or her position or unsure of the score. Then your child might act clumsily. There might be loss of consciousness even for a brief moment. Or you might notice some mood, personality, or behavioral changes. And your child might not recall the events that happened before or after the injury or the fall. And then for older kids, they might complain of a headache or a pressure in the head. There might be nausea or vomiting. Your kid might also experience dizziness, or there might be changes in sleep, concentration or memory problems, or just generally feeling down. You might notice these symptoms after the incident, or it might take a couple of days after the head injury. Then, there are more worrisome symptoms that when your child has any of these, you should immediately bring your child to the ER. This is after a head injury when your child's headache just keeps on getting worse, when your child has weakness or numbness, when your child is vomiting repeatedly or continuously, when you note slurred speech, when your kid is drowsy or can't be awakened, when you notice convulsions or seizures, when your child has an unusual behavior, when your child has experienced loss of consciousness, even for a brief moment. And for babies, if they are crying inconsolably, and if babies does not want to nurse or does not want to feed. Then how does a doctor diagnose concussion? Your doctor would especially be interested on the history, the detailed description of what has happened to your kid, especially focusing on how hard the injury is, if there is loss of consciousness, if their child has had multiple blows to the head. Your doctor would also ask about your child's past medical history, if there are other known illnesses, or if your child has a learning problem, a mood disorder, autism, or ADHD. Your doctor would then do a thorough physical examination, especially a neurologic examination. Your doctor might also use standardized questionnaires or a computerized tool that would determine how severe your child's concussion is. The symptoms of concussion may cause problems for your child. Some children may even have prolonged symptoms that would interfere with their daily activities and sports. During an evaluation, your kid is being checked on the cognitive, behavioral, and physical symptoms. And the tests would check for your child's attention, memory, and speed. The results of this evaluation would be used to create a treatment plan for your child so that your child can return to school and to sports safely. Then, are imaging tests necessary? Then how is a child treated and managed for a concussion? What are the ways to prevent it? But before we go to that, are you expecting a baby? How much better life can be when things are under your control upon baby's arrival, where you feel confident about breastfeeding, you know what to check for, is baby getting enough milk? Then you would know how to soothe a crying fuzzy baby. You would know when to worry and call the doctor. You would know about and recognize postpartum depression. You can get the training that you need in the comfort of your home. I've developed an online training video series known as the 5 Newborn Care Strategies. Do check that out in the description section. So, are imaging tests always needed, such as a CT scan or an MRI of the brain? Well, not necessarily. It depends on the situation, and doctors need specific reasons before doing those tests. This is especially true for kids because you would want to avoid radiation exposure as much as possible. Also, take note that concussion affects how the brain is working, even if there are no structural damages. So, even if your child's imaging tests are normal, your child can still experience symptoms related to the concussion. Kids with concussion are managed and treated individually, and the cornerstone of treatment is rest, that is physical and mental rest as well. Guidelines have also been developed in the context of sports so that kids can return to sports safely and to minimize the risk of re-injury. So follow your doctor's instructions. Again, the main treatment for concussion is to cut back on physical and mental activities. Kids also need to be monitored, but the old advice where you have to wake your kid up to check up on their symptoms is not advisable anymore. Your kid might also need a few days off from school. And you also need to watch out for new or worsening symptoms. Most kids with a traumatic brain injury recover at about 3 weeks, but some kids would have symptoms for longer. And how soon or the amount of time that kids recover from a traumatic brain injury would depend on how severe the injury was, how it happened, your child's past medical history, what treatment has been given, and if you followed your doctor's instructions. It is also advisable that you talk to your kid about concussion so that he or she can report to you any symptom and also report to the coach. Some kids think that concussion is not serious, or if they report them, they won't be able to play sports. Remind them that it is better to miss one game rather than to miss the whole season. Prevention. Although not all concussion can be prevented, some may be avoided. One way is to have your kid wear a helmet for any and all riding activities and contact sports. Your athlete should also be taught safe playing techniques and to follow the rules of the game. Kids should be taught never to ignore any head injury, no matter how minor it may be, and to report any symptoms to you or to their coach. Hey, if you like this video, watch my next video where I teach you about other child health problems.